Hi, this is the group report for Jaylee, Lizzie, Mackenzie, and AJ. So, Sue is an 18-year-old student, and she is just called home saying that she feels sick. She has a headache and a body temperature of 100.6 degrees. As well, her roommate Jill feels the same. She feels sick. She claims that she feels run down and really sore, and her body temperature is 99.7. So, as well, their friend who shares drinks with them all the time and is constantly with them, Maria, is feeling sick. She says the same as Jill, where is feeling run down. And as well, Marco, who is Sue's lab partner, claims that he's feeling sick too. He shares food with Sue on lab days, and he feels extremely fatigued. He has a headache, and he just feels a cold coming on. So could be a really big potential problem, because if an illness is going around the school, it needs to be stopped so all the students don't get sick. The pathogen that it is could be potentially very dangerous, and to contain the virus, the school should start paying attention to it.
So now we will be talking about the medical conditions. So the first medical condition is meningitis, and this is a rare infection which is actually inflammation around the spinal cord and your brain. And this is caused by bacteria, parasites, fungal infection, and most commonly viral infections. And so this is spread by direct contact, so person to person, and it will cause a sore neck, headache, and fever. And some of the most common symptoms are fever, stiffness, nausea, confusion, difficulty sleeping, and skin rashes. So if you notice any of these symptoms, make sure to get it checked out, because this virus can be very deadly. So the next medical condition is strep throat. And so this is when bacteria infects the throat and tonsils, and it spreads very fast, and you can again get it from direct contact, so people to people. Some symptoms are sore throat, painful to swallow, swollen lymph nodes, red throat and tonsils, and also a fever. These symptoms can also lead to headaches, nausea, and stomach aches. The next medical condition that we'll be talking about is the Epstein-Barr virus, and so this is one of the most common human viruses in the world. And a visible sign of it is sores around and inside of your mouth. This infection spreads through body fluid like saliva. So say you're talking to someone and they spit on you, or if they cough on you or sneeze on you, you can get it from that. And then you can also experience some symptoms, which would be fatigue, fever, inflamed throat, rashes, swollen lymph nodes, and swollen liver. The next medical condition is influenza B, and this is spread through physical contact and through the air. So again, if you're coughing or sneezing, that's how it's spread. Some common symptoms are having a fever, a cough, runny nose, body aches, body shivers, sore throat, and fatigue.
The first person we had was Sue. Some of her major signs and symptoms included a headache and a high temperature. Her ELISA test came back positive, and her blast results showed that she had Neisseria meningitis. Next patient we had was Jill. She feels extremely run down and has a slight fever. Her ELISA test came back positive, so we didn't have to test her for blast because we knew she already had Neisseria meningitis. Anthony has a dry cough, muscle ache, and irritated sinuses. His ELISA test came back negative, and his blast results proved that he had influenza B. Wanda had swollen glands in her neck, and her ELISA test came back negative. The blast results showed that she had Epstein-Barr virus. Maggie's throat has been on fire and very scratchy. Her ELISA test came back negative, and her blast results showed that she had strep. Maria's forehead has been on fire, and her ELISA test came back positive. Arnie has a fever and a cough. His ELISA test came back negative, and his blast results showed that he had influenza B. Marco has an extreme headache and fatigue. His ELISA test came back positive. Alvin has a headache and a sore throat. His ELISA test came back negative, but he was not tested for blast results because he did not want to have any samples taken. ELISA is testing the patients for Neisseria meningitis. When a sample is negative, it has a concentration of 0 micrograms per milliliter. The test is clear, indicating that there is no bacterium present. Positive samples have a concentration level greater than 0 micrograms per milliliter. You can tell the bacterium is present by the blue color change. BLAST finds similarity between biological sequences. The program compares sequences with its database and calculates statistical significance. Having a max identity value of 100% means that the nucleotide sequence matches completely with the query. Another way you can check accuracy of your BLAST results is through the e-value. The closer the value is to 0, the smaller the chance of the nucleotide sequence being matched to the query at random.
Next, we'll be talking about the diagnosis. And so we already know that Sue, Jill, Maria, and Marco all tested positive for Neisseria meningitis from the ELISA test, but we still weren't sure about all the rest of the students. So using BLAST, we found out that Anthony and Arnie are both diagnosed with influenza B virus, and this makes sense because they both had similar symptoms and they were with each other for photography and journaling, which makes sense because it was spread through physical contact. And so we also found that Maggie tested positive for strep throat, and this makes sense too because she claimed that her scrot was thrashy and felt like on fire. And the next one is Wanda was diagnosed with the human gamma herpes virus, which is also known as Epstein-Barr virus, and she showed many of the same symptoms as this infection, and then her boyfriend also showed some of the same symptoms too, so we think he has the same virus even though he wasn't tested. Lastly, we aren't really sure what Alvin is diagnosed with, but this is because he refused to test, but he was seen with Wanda because she was giving him coffee, so we're leaning towards that he has the human gamma herpes virus 4. So, yeah.
Treatment for meningitis, Epstein-Barr, strep throat, and influenza B. So treatment for meningitis, in all instances, you just need to be hospitalized for several few weeks. Some might need to get treated for severe viral meningitis. They might need to receive antibiotics. If there's any breathing difficulties, just use a face mask and steroid medication to help reduce any swelling around the brain. Any consequences from meningitis may also call for additional care and long-term assistance. For strep throat, your doctor will probably just recommend some antibiotic, over-the-counter stuff, or you can get in the store like a Rite Aid or something. Advil, Tylenol, other things. Doing this will just help your throat get better. You'll feel better after receiving treatment after a day or two. For Epstein-Barr, to prevent any infection, there isn't really anything you could do about it or a vaccine. So all you have to do is just focus on really hygiene. Be careful with who you're sharing your stuff with. You can't share food with people and your toothbrush and stuff. Just get enough hydration, consume a lot of liquids such as water, healthy stuff, and if anything just get over-the-counter pain or fever drugs. For influenza B, having a lot of rest and fluid intake is really important for this because you don't really need any medicine for it or something like that. You just need to take a lot of fluids and rest to recover from influenza B. But if it's severe or experience complications, your doctor can advise antiviral drugs to treat the flu. Some medicines like Tamiflu, Relenza, Rapivab. Those are examples of medications. These medications could just cut the illness a day or two, help you heal faster. And that's pretty much it.
At Seuss College, many precautions should be taken so that the spread of the virus does not increase. Seuss College should alert all the students and provide instructions to prevent infection. Other precautions such as quarantining or masks may be implemented. Being in a group setting may have increased the rate of the disease spreading. The college might also recommend an optional date for vaccines for the virus.